Hello, I'm Dr. Bridget Nash, and I'd like to welcome you to The Therapy Show, a podcast series that seeks to demystify mental health treatment. Today, I'm honored to welcome Dr. Molyn Leszcz, who is a professor in the Department of Psychiatry at the University of Toronto. Dr. Leszcz is the president of the American Group Psychotherapy Association, which is the foremost professional association dedicated to the field of group psychotherapy, which is the topic we will discuss today. He lectures broadly and has published extensively in the group therapy literature regarding evidence-based approaches to group psychotherapy. Dr. Leszcz co-authored with Dr. Irvin Yalom the seminal book, Theory and Practice of Group Psychotherapy, which was published in its sixth edition in 2020. Dr. Leszcz, welcome to The Therapy Show.
Thank you so much, Bridget. It's a pleasure for me to be on this podcast with you and to participate. I love the work that you're doing, and it aligns very much with what I think is important, and that is educating consumers about how to get the best care with regard to mental health.
Thank you very much. Can you start by telling us a little bit about your personal background and professional development that led you to your research in the field of group therapy?
Sure. I'm a psychiatrist. I graduated a number of years ago. I've had a career interest in group psychotherapy, both clinically, educationally, and from a research perspective. And I've had very good opportunities for training and development. But if you ask the question, how did I get interested in group therapy? It goes back to my early roots. My family were survivors of the Holocaust. They emigrated to Canada after the war. And there was no extended family because of the decimation of the war. So what was important, what became family, were the communities of other survivors that formed. There was no next generation. It was parents and their children. And I saw the value and power of community and the value and power of these naturally forming groups. And when I became a psychiatrist through my training, I always sought opportunities to work with groups and believed that there was an unusual power in group therapy and group treatments that I wanted to maximize. I wanted to facilitate for others. And that's what's led me into group therapy research and writing and publication for 40 years. I've been involved in senior positions at the University of Toronto and at Mount Sinai Hospital in Toronto, and have felt every day that understanding how groups work has helped me to be a better administrator, a better leader, a better chief, a better university vice chair. And I see groups as a way to make people better in many, many ways. So that's how I got into this. And then I had an opportunity to train with and subsequently work with Irvin Yalom, who has really developed group therapy in North America right from the beginning. And he and I have collaborated for the last number of years. We've written a couple of books together. The latest one is coming out next year on the theory and practice of group psychotherapy. So that's how I got to where I am at this point.
How would you briefly explain the field of group therapy to a non-professional?
Groups are a form of care and healing for individuals that makes use of the power of connection, the power of relationships, the power of peers. It builds upon the kinds of models that go back hundreds of years of mutual aid. Group therapy can be more formal, of course, but the idea is helping create healing networks for individuals. And there's a range of different kinds of groups. It depends very much on models, on client need, but fundamentally, the group is intended to be a healing force. Some groups really serve just as a setting to deliver a group intervention. So you might participate in a psychoeducation group on how to deal with depression or how to deal with anxiety in your adolescent, or how to prepare for parenthood, or how to cope with cancer. Other groups focus more on using the group not as a setting in which you deliver an intervention, but using the group as an agent to promote self-awareness, learning, growth, and development. So if I give you an example of what I mean by that, let's say somebody goes through a divorce and they might participate in groups in two ways. The first would be a time-limited, brief group focused on helping people adjust to the initial phase of a divorce and loss, coping skills, learning about the meaning of a divorce, and helping people restore a sense of, okay, I can get back into the world again. That may be more than enough for many people, but there will be some people who will then want to go into a group that dives deeper and provides them with an opportunity to understand, how did I end up in this relationship that disappointed me? What can I learn about myself in my relationships that puts me in a better stead going forward? What kind of knowledge do I need to have about myself? How can I improve the way in which I communicate, or the way in which I deal with feelings of vulnerability, or allow myself to become more emotionally intimate? So there's a whole range of ways in which groups work. And I think we look to groups to provide peer support, self-understanding, an opportunity to learn about how I come across, how I relate to others, how to gain coping skills. But all of it is embedded in the group being a safe and cohesive environment. I tell clients when they're coming to see me about group therapy, it's a team sport. For that hour and a half on Wednesday evening, nothing is more important than you being at the group, because you need to be there for others, others need to be there for you. The trust that develops through reliability, predictability, the evidence of mutual commitment is part of the healing that happens in the group. I've had patients say to me that the group is the first place where they felt a sense of deep trust and deep acceptance. Those are kind of the cornerstones of group therapy.
Many inpatient and outpatient treatment programs use group-based structures in their milieus. Can you explain the difference between how these programs use group therapy in terms of process groups and skill groups, and how group therapy theory should inform group therapy practice?
That's a great question. And I think it leads us into a discussion of the difference between group programming and group therapy. And sometimes there can be a confusion between these two. Group programming would be watching a movie together on the inpatient unit and discussing it, or having a lecture about addiction. Group therapy involves a much more interactive, interactional process where people are not passive recipients of information, but are, in essence, part of the curriculum, if you will. You talk about the use of groups in these settings, inpatient settings, partial hospitalizations, day treatments. Groups are really the mainstay of treatment because groups are powerful. The evidence about research regarding group therapy shows that groups are effective. Groups are equivalent, by and large, to individual therapy. And the reason they're so broadly used is because they are efficient with regard to therapist use and time. So by a factor of 2, 4, 6. And I'll talk a little bit about the efficiency issue because that's a double-edged sword. It is both part of what is appealing about group therapy and sometimes part of what deters people from group therapy because it makes people think that they're getting a second rate or a discounted treatment. Before moving on to further discussion, I want to share with you a very interesting, very compelling story about the use of group therapy and the development of a training program to help people who work in an acute care general psychiatry unit, kind of the challenging clinical environment that you see on TV shows. There's a large behavioral health program in the States that provides care to thousands of patients every year. And they were unhappy with the quality of what they were doing on their inpatient unit. It was what they called meds and beds. People came in, short admissions, and then there wasn't a lot that was therapeutic that was happening until the leaders of this program decided that they were going to train 60 social workers in their program how to do group therapy with these difficult, often acutely psychotic, agitated, distressed, and disturbed patients. And in short order, they were able to transform the quality of care in these units. And these are a number of hospitals across a number of states. And what did they find? The quality of care went up. Patient satisfaction went up. Adverse incidents, violence, aggression went down significantly. And staff morale soared. So being part of an effective group is not only healing for the participants, it also adds to the morale of the people who work in this field. It's a powerful story about what properly done, properly trained, properly led groups can do.
Who is group therapy most effective for, and why should someone choose group therapy over many other types of mental health treatment services?
The research, and there's robust research that shows this, group therapy is by and large equivalent in effectiveness to individual therapy. Large studies show this over and over again. What matters is that the group, like individual therapy, is well done and well conducted. What's key is that the client has to come into this with a sense of interest. It's got to feel like it fits. Sometimes there's an important piece of work before people come into the group to help demystify group therapy and make it feel less daunting. But the short answer to your question, for whom is it most effective? I would say it is equally effective for virtually everyone. Sometimes people need some individual treatment to help with management of symptoms, management of distress. But if people can see the group in terms of its full potential and develop what is described in the literature as a therapeutic alliance, which is the agreement that the client and the therapist have about the goals of treatment, about the tasks of treatment, and about the quality of the relationship, then they're off and running. Client expectations matter. If a client has a particular idea of what they need, then they're more likely to benefit from that than getting assigned to something else. So where possible, I think the client and the provider need to work together and make a choice that fits. But what people can know is that if they come into a therapy group, they are as likely to benefit as coming into individual treatment. And the fact that it is a more efficient, more affordable treatment is not a reflection of it being a less effective treatment.
What's the average length of treatment for somebody attending group therapy?
Well, again, it depends on what the objectives are. So to go back to that first example of somebody who comes into a brief group to get back on track after a divorce, that might be a psychoeducational group. It might be a CBT group, learning skills about re-engagement, about overcoming social anxiety, about strategies to maintain mood. That group might be anywhere between 4 and 12 sessions. A more intensive skill-oriented group using CBT or interpersonal therapy skills might run for 20 sessions. What research shows is that many people do well in group treatment that runs for about 20 to 30 sessions. So we're talking about once a week for 5 to 8 months. People who have more chronic difficulties or where personality issues are more prominent need a longer course of treatment. And for people with those difficulties, probably 2 years of weekly treatment would be required. So it depends on what the client needs and how they're willing and able to engage in the treatment.
What skills, habits, or tactics can clients and therapists adopt either during their sessions or in between sessions to improve the effectiveness of group therapy?
There has to be a commitment to using the social microcosm of the group as a way to learn about oneself, but then to create an adaptive spiral where one takes the learning from inside to outside. I've had many clients in group therapy say, I can do this here. I can be open here. I can take risks. I can be compassionate to others. I can share my vulnerability, but I can't do it outside. A lot of work needs to go into that adaptive spiral, taking from the inside to the outside. And what I encourage is for people to maintain a reflective position, that they're studying themselves, thinking, okay, here's something that I've seen before in myself, in the group. Now I have an opportunity to try and do something different. So that self-reflection is critically important. And people need to practice every kind of psychotherapy, even the most psychoanalytic psychotherapy, involves behavioral change, behavioral reinforcement. You got to take risks. You take risks first in the group, develop a sense of this is doable, and then you begin to take that outside of the group. Look to seize opportunities.
What are the most common obstacles or missteps that prevent therapists and clients alike from seeing the full benefits of group therapy?
Well, I think we know that there is still substantial stigma around mental illness. And I think that within the domain of mental health care, group therapy may be viewed in an even more stigmatizing attitude than individual treatment. Why is that? I think some clients fear exposure. They fear that they will be shamed. They fear that they will be pressured. They fear that they will be judged. They fear that they will be bullied. Many people for whom group therapy is particularly helpful don't look at group experiences as being part of what has been helpful to them in the past. They think of groups as vehicles for bullying, vehicles for marginalization, for alienation. So they need to see that this can be different. So one of the obstacles is stigma. I think we also have to pay very careful attention to the role of culture. Many of the models of psychotherapy are based upon Western conceptualizations of emotional well-being. And more we see people from different parts of the world. I've done 10 years of work in China, for example, training group therapists. But you don't have to go to China to see the impact of culture. You can see it in your own community. Some cultures have a very different approach to authority. They're much more deferential. The idea of self-assertion feels like anathema. It doesn't feel like something that is culturally appropriate. The idea of emotional expression can similarly be not acceptable within certain cultures. So we have to recognize that, and we have to modify our treatments to accommodate for that.
Can you share a poignant example where group therapy had a major impact in someone's life without sharing any identifying information?
Sure. Let me give you one example from a very specific group that I did, and then I'll give you another example from a more general group therapy. So the first was a group psychotherapy trial that I was involved with, looking at how group therapy could help women with advanced breast cancer cope. And we had originally hoped that we would be able to see a survival benefit, that people who participated in group therapy were able to function and live for longer than people without group therapy. That finding, unfortunately, has never been replicated. We weren't able to replicate it. But we did show that participating in the group had enormous impact on people's quality of life. And these were women who were all facing mortal illness. Almost all of the women in our study over time died because advanced metastatic breast cancer is for most people a terminal illness. But I remember so clearly a woman in the group, a 65-year-old woman, saying that she was in a brief state of remission and she would love nothing more than to take advantage of this period of well-being to go visit her older brother overseas who was too unwell to come and visit her. She knew that this would be the last time that they could get together. And the other women in the group encouraged her to go and take this trip and seize the moment, to use existential awareness as a way of deepening engagement in her life. And she said, I'd love to go, but I can't because I am responsible for looking after my 92-year-old mother-in-law. And I see her every day. I take her shopping. I make sure that everything she needs is looked after. And the group fell silent, imagining that this remarkable opportunity was going to evaporate. Until one woman in the group said to her, you know what? You have 4 adult children. Give them the gift of giving you this trip. Get them to look after their grandmother so you can make this trip. It was like a light bulb went off. This woman said, you know what? I'm going to do that. She came back the next week and said her children were all in, eager to do this. She went, had a marvelous trip, came home, and came back to the group and became ill a week after and died 3 weeks later. Her 4 children sent a note to the group afterwards saying, thank you. Thank you for encouraging our mother to make use of us so that we could do this for her before she died. She was an incredible woman, but she never let us do things for her. This was the first time we had an opportunity to try to balance the books, and it is going to make our grief much easier. So it was a remarkable experience for this individual, for the group, for me as a group leader. I still feel emotional when I think about it, and for her family. And so that's part of the power of good therapy. It's not only better for the individual who is the identified focus, it creates change, ripples that affect everyone in that person's environment. An example emerging from a group that is not specific to a particular illness or ailment, but consists of people with issues of depression, anxiety, substance abuse, and trauma. A woman who came in to group therapy because she always got into fights with people. Her professional life was hampered by the fact that people just didn't like her. They didn't like working with her. And what unfolded in the group was her recognition that the idea of justice mattered more to her than anything else, and that if somebody did something wrong, they needed to be punished. And she would do that in relational ways. And what happened that was most useful for her in the group was the development of a capacity for compassion for others. And of course, as we dove in deeper, we recognized, and she recognized, that not only did she lack compassion for others, she lacked compassion for herself. She had a very black and white view of the world. And the group was really transformative for her with regard to understanding more of what lies beneath the manifest. She said it was kind of like getting X-ray vision into other people's psychology, so that if somebody did something that I didn't like, instead of my condemning them, I could ask the question, why would this person do this? What's contributing to it? What's upset them? What's hurt them? And so again, you see the individual benefit and the people in that person's world benefiting as well.
And often the other group members can say to the other person in the group things that you as the therapist or the facilitator can't. And that was what I think is so special about group.
You are so right. There are many times when clients will say, well, to me as the group leader or the therapist, well, of course you're going to say that. You know, you're a therapist, or that's your job. There's something compelling when it comes from other members of the group who are not professional, but have enormous wisdom. And the ability to use their wisdom to be helpful to others is another one of the therapeutic factors in group therapy. You've heard me talk about self-understanding and interpersonal learning and self-disclosure. Altruism is another important mechanism in group therapy because it's the one treatment that people will come to sometimes when they don't have anything that they need to work on themselves that day, but they come because of their commitment and obligation to others in a good way, and it elevates their own self-esteem and their own sense of self-effectiveness by being able to be therapeutic and helpful to others. Time and time again, I have seen members of groups receive things from other members of the group that they would never be able to take in or hear from a therapist. We are viewed as professionals. It's our job. We get paid to say these things. There's a kind of realness that comes from other members of the group that is much harder for people to refute or deny. And lots of people seeking therapy have trouble taking in good things. And it's harder to not take in good things from your peers than it is from a professional.
Who is group therapy not appropriate for?
One of the things about group therapy is that it's not flexible. The group meets every Tuesday from 5 till 6:30. If somebody travels a lot, if the logistics are hard, it's not like they can reschedule. So you need to have logistical flexibility. You need to be able to make a commitment to the group. And you need to see that there's a relational underpinning to your difficulty. If you don't have that, then you're going to find the idea of working in a group, working with others, getting feedback, using the group as a social laboratory, it will feel like it's not relevant. Groups also work less well for people who tend to be really hostile and attacking because they can make the group unsafe for others, and for people who externalize and blame others. So there has to be a certain kind of willingness to take a look at oneself in order to make groups successful. Now, you might say, well, there are lots of people who are like that. And if we look, for example, in settings that focus on addiction, there's a lot of denial, there's a lot of disavowal, there's a lot of externalization. There, the homogeneity of having lots of people in the group with these kinds of worldviews kind of paradoxically becomes a way to make it more effective and more impactful because people are able to call it out in one another or challenge one another. But the issue around fit and making sure that the group has an opportunity to become cohesive is job one. And there's an enormous amount of evidence in the research literature that in order for a group to be effective, it must achieve a level of cohesion. So that means there has to be an adequate fit for people in the group. And when you ask the question, for whom is group therapy not appropriate? I would say that for most people, we can find a group that is appropriate. It might be a more homogeneous group. It might reflect some of the things that keep them out of some groups, might be the ticket to come into another group.
What are you most excited about in mental health treatment today?
Lots. I think that the work that the field and society at large is doing to reduce stigma and improve people's sense of the acceptability of care is growing. The last 10 years, you take a look at politicians, star athletes, actors, musicians, talking about their own mental health issues, their own addiction issues. It makes it much more possible for other people to say, well, if this person is successful and they have difficulties, then I shouldn't feel so ashamed about my pursuing care for myself. The other thing that excites me is that there is growing attention paid to the idea of quality of care. Through rigorous evaluation, we have a much better understanding of who and what makes for an effective therapist, who and what makes for an effective group therapist. And there are pathways that people can invest in order to promote their growth and development as group therapists. So there's been a certain kind of irony in that group therapy is a much more complex treatment to deliver, and we need to make sure that our training matches the requirements of people who are doing group therapy. I am an active member of the American Group Psychotherapy Association, and one of the things that's been very important to us is to establish training standards, professional practice standards. So many members of our large organization are what we designate as certified group psychotherapists, CGPs. That signals to a consumer this person has special training in group therapy. They make a special commitment to continuing to professional development. They're part of a community of practice. These people are real experts in group psychotherapy. We've been delighted in 2018 that the American Psychological Association recognized group psychotherapy as a designated specialty. That's going to have a dramatic impact on the way in which people train, the way in which graduate programs train group therapists, and I think we're going to see an ever-increasing commitment to quality of care. That's what excites me the most about group therapy: acceptance and improvements in the quality of the work that we do.
If you had a magic wand and could improve one thing about mental health treatment today, what would it be?
Parity. That mental health coverage be covered to the same degree as medical health coverage. There are still enormous gaps in people's access to mental health care because insurers do not cover it to the same degree that they cover medical care. If we covered cancer the way we cover depression, there'd be riots in the street. So it's important that people be advocates for good quality care, that they insist in parity. That to me is the biggest obstacle. Group therapy is effective, it's powerful, it's impactful. It needs to be accessible to people. It needs to be something that clients can access in the pursuit of care. And the providers need to feel that it is being supported and recognized as such by third-party payers and insurers. That's what I hope I could change if I had a magic wand. That's why I'm so pleased to be part of this podcast with you, because it's important, I believe, to educate consumers about what kind of help may be available to them so that they can become better advocates for themselves and for others as well.
Thank you for that. I agree. It's so important for the consumers to ask for quality group therapy and from trained therapists in group therapy. So how can my audience learn more about your work, either online or in print?
Well, I would encourage people to check out the American Group Psychotherapy Association and to go to our website. I think you've provided some links to that. Consumers will also find links there to certified group psychotherapists all across the United States. My work is published in the professional literature, and I would encourage people to have a look for the book that I've done with Irvin Yalom, The Theory and Practice of Group Psychotherapy, and other publications and references that you have listed already elsewhere on the website. I'd be delighted with that, and I would encourage people to ask questions about their care and to look for resources. Again, the AGPA is a terrific source of those kinds of resources, and I have some video broadcasts that you can access through that as well. We have a YouTube channel, and some of my written work is also accessible through there and through the peer-reviewed literature.
Dr. Leszcz, on behalf of myself, my listeners, and all of the people you have helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience better understand the field of group therapy.
I've been delighted to have this opportunity, Bridget. I thank you for inviting me to do this, and I hope that it contributes to people gaining more access to care, and I wish you continued success in the work that you do.
Thank you very much. I really appreciate it. I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so that you, someone you love, and people around the world can benefit more from therapy. There is no need to suffer in silence. Get the help that you need to create the life that you want.